We have new details today about how COVID is impacting young children. Nearly 1 million cases of COVID-19 were reported among them in the United States last week. That's according to the American Academy of Pediatrics. That number is up 69% from the week before. Definitely concerning. Children in Georgia have been diagnosed with COVID at a higher rate over the last few weeks, but hospitalizations are not increasing at the same pace. Aisha Howard spoke with 11 Alive medical correspondent Dr. Sujatha Reddy, who says there is promising news.
Good morning. A lot of you may be wondering where I am, and I'm in quarantine. COVID paid my family a visit, and it started with my 1-year-old daughter. So, of course, as parents, Dr. Reddy, that makes you so concerned. The fact that she tested positive, you spend all your time trying to protect your kids, and then it seems like the little ones were just no match for Omicron. So at the beginning of the pandemic, you rewind, a lot of people were saying that, oh, it's not impacting kids. What are we seeing now?
The good news with Omicron is it seems to be less pathogenic. I mean, it doesn't seem to make the person as sick, but it is a lot more contagious. And it does seem to be infecting children at a higher rate than the original coronavirus and the variant Delta. So we are seeing more pediatric cases like your sweet daughter.
And so, what's the level of concern that parents should have here? Because we're on high alert just across the board. So, when we hear that it's impacting kids, in some states, record numbers here, what should we be looking out for? How should we be handling this?
Yeah, so I think when you have a child that tests positive, the thing to do is take a big breath and try not to be overly concerned. You're going to take care of your child just like you would any other respiratory infection, probably with a little more, careful eye just because it is coronavirus. But we still know that in general, with Omicron, the severity, the symptoms are not as severe or as likely to cause serious illness. And that's good news, especially with kids. And just like with the original and with Delta, kids don't seem to be as vulnerable to serious illness as older adults or people with underlying conditions. Having said all that, even though we know it's a small number that are going to get a serious symptom or serious case of coronavirus right now, as far as kids, if we have a very large number of children that are infected, even a small percent of a large number can be a big number. So, and we are seeing that with pediatric hospitalizations. So even though we're seeing more kids that are getting sick, their odds of getting a serious illness is still very, very low. And I think that's what parents need to take to the bank. I think when you have a child, you learn the things you have to watch out for, right? You make sure they're not getting dehydrated. If they have a high fever, you call your healthcare provider, give them something to knock down that fever. But you look for all those signs and symptoms that are concerning. Any trouble breathing, you automatically call your healthcare provider or go to the hospital. So those kind of serious warning signs are the same, whether we're talking about RSV, coronavirus, flu. You're still looking for those kind of things when you're talking about an infant or a toddler.
Yeah, and it's just scary across the board.
Some great info there from Aisha and Dr. Reddy's interview, so thanks to them for that. Pediatricians still have concerns. They say the majority of vaccine-eligible kids in Georgia still have not been vaccinated. In fact, only 16% of kids aged 5 to 9 and 35% of kids 10 to 14 have received at least one dose.